friends, welcome to Easiness. So in this session, we are discussing regarding the most important and definitely appearing questions for your upcoming third year GNM exams. So in this session, let's start with the subject that is gynecology. So the first important question is sexuality. Sexuality is the sum total. So we can see the sum total of the feelings as well as the behavior. It has been shaped from our values, from our attitudes, and also we can see from the behaviors. It has been shaped the physical appearance, the beliefs, the emotions, personality, likes and dislikes. So the sum total is called as the sexuality. So let's have a review on the menstrual cycle. So menstrual cycle is naturally occurring and also recurrently it has been seen. It is a recurrently seen event in a female reproductive system. So a female with a reproductive age, this process of menstrual cycle, it comes on repeatedly or recurrently, and it usually lasts for about 28 days. So usual menstrual cycle is for 28 days, and this can vary according to different hormonal changes. It's not the same in each woman. There might be different changes due to the hormones. So there are 4 major cycles, or we can say the stages or phases of this menstrual cycle, which is very much important for a 10-marker question with certain additional questions. So the first one is the menstrual phase, which is lasting from day 1 to day 5. So most probably within 5 days of the menstrual cycle is your menstruation phase. So the cycle, it begins with the menstruation. So we also call it as menstrual bleeding. So which occurs when the uterus shreds off its lining if the fertilization does not occur. So here, if the fertilization has not occurred in our previous cycle, then there is shredding out of the lining, the inner lining of the uterus. So this stage, it lasts between 3 to 7 days. In few women, it might be 3 days. In few women, it might be for 5 or 7 days. So on a total, we are saying it might last for 3 to 7 days. Coming to your second stage is your follicular phase. So it will be for around, we can say, 6th day to the 14th day. So it can last from your 6th to the 14th day. This phase, it involves the formation of the follicles in the ovaries. What happens in this phase? There might be the formation of the follicles in the ovaries, each of which it contains an immature egg. Here, the egg is not in a matured stage. It is undergoing the process, we can see what it is undergoing, each which contains an immature egg, and the formation of the follicles will be taking place in the 6th to the 14th day of the menstrual cycle, that is the follicular phase. Coming to your third phase is the ovulation phase. It is usually for about the 14th day. The day, usually it will be about 14th day the ovulation can occur. It is a rise in the luteinizing hormone. This luteinizing hormone, it increases, or there will be rise in this hormone, which is usually stimulating the release of the mature egg. Since in the previous follicular phase, it was an immature egg, now it is making sure there is a release of this mature egg from the follicle midway through the cycle, and hence it is occurring on the day 14th of the menstrual cycle. And the last phase is the luteal phase. The day is usually 15th to 28th day. The luteal phase occurs. The ruptured follicle, it gets converted into the corpus luteum. This stage, how you are distinguishing it? We are distinguishing it by increased progesterone production, which will be preparing the uterus for a possible pregnancy. If there is any fertilization occurring, then there might be possible pregnancy. And in this whole luteinizing phase or luteal phase, the uterus is preparing itself for the upcoming pregnancy. So these are the most important phase or stages of the menstrual cycle. So let's look on to our second question, that is premenstrual syndrome. So what is this premenstrual syndrome? It is a group of physical, emotional as well as the behavioral symptoms which is occurring in the luteal phase. So as we just saw in the luteal phase, the last stage of the menstrual cycle, there are certain group of physical, emotional and behavioral symptoms seen in the women. So this is especially in the menstrual cycle stage, the last stage, you can see these kind of changes. Typically, it can be resolved only after the onset of the menstruation. When the woman goes to the menstruation phase of the menstrual cycle, only then these symptoms can resolve. So that stage, these symptoms where it is seen is called as premenstrual syndrome. So it is seen there are common symptoms, for example, the mood swings, irritability, fatigue and bloating is seen in this premenstrual syndrome in the women who is experiencing these symptoms. So we can see the symptoms like mood swings, irritability, anxiety, fatigue, bloating in the stomach, breast tenderness symptoms and food cravings. Regarding a certain specific food cravings is seen in the woman who is experiencing premenstrual syndrome. And you can see the prevalence rate, it is affecting up to 35 menstruating individuals, especially the women's, for you can see 75% of the menstruating women who is experiencing this premenstrual syndrome, 20 to 40% they are experiencing moderate to severe symptoms. So 75%, under that 20 to 40% extreme symptoms are seen. This premenstrual symptoms are seen. Next, we move on to what are the causes. Exact cause, it is very much unclear. We don't know what is the exact cause, but the hormonal fluctuation, neurotransmitter changes, for example, as we just told, serotonin. So these neurotransmitter, it plays a very important role in all these symptoms being shown in the women. So exact causes are unknown. Basically, there are neurotransmitter fluctuations or changes which is causing these symptoms. So let's see what are the diagnoses based on what kind of symptoms the women is experiencing. For about 2 to 3 menstrual cycles, we are seeing what are the different symptoms they are experiencing. Based on that, we are predicting that this woman is having premenstrual syndrome. There is no specific tests which is existing to identify this premenstrual syndrome. So let's see what are the treatment options. It involves the lifestyle changes, the way your activity is. So how well you are exercising, how well you are managing your stress, what is your dietary adjustments, medications like non-steroidal anti-inflammatory drugs or hormonal therapy is given in order to decrease these premenstrual syndromes. And the next one is the severe form of premenstrual syndrome is the premenstrual dysphoric disorder, which is usually affecting 3 to 8 individuals who is experiencing this premenstrual syndrome. If in case this PMS or premenstrual syndrome is not being treated, then it can go to worsened form of premenstrual dysphoric disorder, which you can see the prevalence rate is 3 to 8% in all the menstruating women. And due to this impact of premenstrual dysphoric disorder, you can significantly, the person's daily life is being affected, his work or her work is affected, and the relationships are also affected. The impact of this premenstrual syndrome as well as premenstrual dysphoric disorder. So this is also one of the most important question which can be asked for a 5 marker. So let's move on to our third question, that is infertility. What is infertility? It is the inability to conceive or to get pregnant after 12 months of the regular as well as the unprotected sexual intercourse, or after the 6 months for the individuals over the 35 years old. So normally, if a couple is unable to get pregnant for 12 months after the regular as well as the unprotected sexual intercourse, or if a couple is about 35 years, after 6 months of regular as well as unprotected intercourse, if they are unable to get pregnant, then the condition is called as infertility. So there are certain factors which are the causative agents for this infertility. So in males there are different causes and in females there are different causes. So let's look on to the causes of infertility in the males. The first is due to the low sperm count. When there is insufficient sperm production itself in the males, then that can be one of the cause. Poor sperm motility, in the sense when there is reduced ability of the sperm to swim in the uterus, or when it is penetrating, that time if it is not moving properly, then that also can be one of the main cause for infertility. The next is abnormal sperm. If the structural abnormality is present in the sperm, then that becomes one of the main cause for infertility. Irregular shape, structure of the sperm. So next is the hormonal imbalances. Low testosterone or other hormonal issues, it can also be one of the main cause for infertility in males. The next one is obstruction. When there is blockage in the sperm transport or the pathway, for example, the vas difference. If there is any blockage in the vas difference in the males where there is no movement of the sperm, at that point of time also infertility can be caused. And the next is infections, that is sexually transmitted infection or other infections which is affecting the reproductive organs in the males. So that can be one of the main cause of infertility in the males. The next one is lifestyle factors like smoking, alcohol, obesity, stress. This can also lower the sperm count, and also you can see there are any kind of abnormal sperm produced due to these lifestyle factors which causes infertility. And the final cause is medical conditions. For example, varicocele condition, genetic disorders and testicular injuries. If there is any injuries in the testicles of the males, then that can be one of the main cause for infertility in the males. So these were the causes for the males. Let's see what are the causes of infertility in the females. The first one is the ovulation disorders. You can see the hormonal imbalances. Example, the post-traumatic stress diseases, PCOS, hypothyroidism. These are the certain causes where there is hormonal imbalances which leads to ovulation disorders in the females. The next cause is tubal blockages. When there is fallopian tube damage or obstruction in the fallopian tube, the ovum, the mature ovum cannot move on through the blocked fallopian tubes, and hence fertilization doesn't occur. The next cause is uterine issues. You can see fibroids, polyps, structural abnormalities in the uterus where fertilization has to take place. So due to this uterine issues, there is no fertilization and hence infertility. The next cause is endometriosis. The tissue similar to the uterine lining, it grows outside the uterus. So this endometriosis also can be one of the main cause of infertility. The next is age. When there is decline in the egg quality and quantity with the age. The quantity of the egg also reduces as well as the quality of the egg, the ovum, it also reduces due to the age, increased age. The next is hormonal imbalance. As I just told you, issues with FSH hormone, LH hormone or prolactin. These hormones play a very important role in the menstruation cycle of a woman. And hence, if there is any imbalance in these hormones, the ovulation itself doesn't occur properly and hence infertility. And the last cause is infections. You can see pelvic inflammatory diseases or sexually transmitted diseases, which can be one of the causative factor for infertility. And the next is lifestyle factors. As I just told you, stress, poor nutrition, smoking, excessive weight changes in the women also can be one of the main cause for infertility. So these are the n number of causes we can see of infertility in males as well as in the females. So let's move on to our next question, that is, pelvic inflammatory disease. What is this pelvic inflammatory disease? It is an infection of the female reproductive organs. So any type of infection you can see in the uterus, in the fallopian tubes, as well as in the ovaries, this all include or come under the female reproductive organs. Any kind of infections in these regions, then it is called as pelvic inflammatory disease. Keep it in your mind that it is also a 5-marker important question. So it can be clubbed with another question for more than 5 marks as well. So it typically results from the sexually transmitted infections that can cause pain, fever and infertility if in case this condition is not treated. So you need to treat it as soon as possible so that there is no other further complications of infertility. So let's see what are the main causes. Commonly, it is caused by the sexually transmitted infections. For example, chlamydia, gonorrhea you can see, but it also can be caused due to non-sexually transmitted infections as well. Not only sexually transmitted infections, but in some cases, even the non-sexually transmitted infections can also be one of the main cause for pelvic inflammatory disease. The symptoms include pelvic pain, abnormal you can see vaginal discharges in the women, fever, painful intercourse and irregular menstrual bleeding is seen in the women in certain cases who are affected by the pelvic inflammatory disease. And next we see how do we diagnose this condition. Based on the symptoms, the pelvic examination is done, ultrasounds, laparoscopic tests are done, lab tests in order to identify what are the underlying infections which is causing this pelvic inflammatory disease. So let's see next, complications. What can be the complication of this disease? It can lead to infertility. As I just told you, infertility, if in case the pelvic inflammatory disease is not treated in the earlier stages, it can lead to infertility. It can lead to chronic pelvic pain in the women. You can see ectopic pregnancies, abscess formation or pus formation if in case it is not treated. These are certain complications that can be if in case pelvic inflammatory disease is not treated in the exact time. The next, you can see how do we treat it. Typically, it involves antibiotics and in severe cases, hospitalization or surgery also is required if it is untreated in the earlier stages. So, prevention, you need to practice a safe sex practices. So, having a safe sex practices is very important in order to avoid this sexually transmitted infections. So, regular screenings, that is sexually transmitted infection screenings should be done very regularly and prompt treatment for infection in order to reduce the risk of infections. So, you need to treat the infections properly. So, these are the preventive measures and prevalence. For example, the affected women of the reproductive age, you can see especially those with multiple partners or who is having a history of sexually transmitted infections. So, who are having more of this? Which women we can see this pelvic inflammatory disease? Example, we can see people who are having multiple sexual partners or who is having a history of sexually transmitted infections. So this is about pelvic inflammatory disease. So let's move on to our next important question, that is tumors of the reproductive tract. So basically what are these tumors? It is abnormal growths. Either it can be benign or which is non-cancerous or malignant which is cancerous. That is, it is spreading from one place to another place which is arising in the reproductive organs. For example, uterus, ovaries, cervix or testis. It is both in males and females we are speaking about. Here it can be uterus, ovaries, cervix or testis. So here it can affect the fertility and overall reproductive health in a person. So these tumors can be benign or malignant. There are different types of these tumors of reproductive system. Includes benign tumors like fibroids, cysts and malignant tumors like cancers of the uterus, ovaries, cervix and testis. So in males and females, you can see fibroids, you can see cysts which are non-cancerous, malignant tumors, for example, cancers of uterus, ovaries, cervix and testis. So you can see the uterine tumors or fibroids, which are benign, which are common, while endometrial cancers, the malignant one, it can affect the lining of the uterus. Next is ovarian tumors. It includes the benign cysts and cancers like the epithelial ovarian cancers, which is oftenly diagnosed in the later stages. It cannot be diagnosed as soon as possible. Usually it is often diagnosed late. Next is cervical tumors. Cervical cancers, often it is caused by human papilloma virus infection. If in case this virus has been infected, then you can see the cervical cancers. It is leading to cause or cancer related deaths in the women. There are certain causes, certain cases wherein which there is also death related to the cancer of this cervix. And the next is testicular tumors, which is most are malignant ones such as testicular cancers, which often affects the young men. So testicular tumors, it has been affecting the young men in prevalence. And the next is symptoms we can see. It can include abnormal bleeding in females, pelvic pain, abnormal growths, or you can see changes in the menstruation pattern, the cycle. There might be changes in the menstruation pattern as well. Diagnosis. Your diagnosis involves the imaging tests, ultrasound, CT scan, biopsies, which is a confirmation test for the tumor cells, and blood tests, for example, like CA-125 for in case of ovarian cancer. We are doing this particular CA-125 test. That is also one kind of a blood test in order to identify or confirm the ovarian cancer. Next is treatment. How do you treat this? The treatment options include surgery, chemotherapy, radiation therapies, and hormonal therapy, depending upon which stage the cancer is and the type of the cancer. Is it malignant or is it non-malignant cancer? So this was about the tumors of the reproductive tract. Let's see what is mastitis. Mastitis is the inflammation of the breast tissues. Often it can be due to the infection that can result in the pain and swelling, redness, and sometimes you can see fever also in the females. So it is the inflammation of the breast tissues. It is most common in the breastfeeding women, but it can also occur in the woman who is not breastfeeding as well. So this condition is called as mastitis. So what are the common type of causes? So what are the main cause for it? It might be due to the blocked milk ducts. So it is commonly seen in the breastfeeding women. When they are breastfeeding the children, if there is any kind of blockage in the milk duct, that can be one of the cause, and bacterial infections or the breastfeeding related issues, which can be one of the cause for this mastitis. So these are the important causes. So let's move on to what are the symptoms. It can be redness, swelling, pain, warmth, and sometimes fever and chills also is seen in the women wherein which who is having this mastitis. Next, let's see what are the risk factors. Breastfeeding. So especially during the first few weeks, there is very much difficulty for the woman who is having mastitis to breastfeed the babies. So poor latching. The baby cannot latch to this nipples of the breast of the mother. So this also becomes one of the risk factor, or incomplete breast emptying. The completion or what we can say, the breast does not empty, the baby cannot suck the milk, and hence there is incomplete breast emptying in the women. These are certain risk factors. Coming to the diagnosis, based on the clinical symptoms, we are doing the ultrasound. We are also checking for milk culture. So it may be used if it is necessary. So maybe due to the thickness or more amount of any kind of protein in the milk, which can cause to blockage. So you're checking it and doing the milk culture as well. And the next one is treatment. It includes the antibiotics, pain relievers, frequent breastfeeding or pumping is necessary, and warm compresses to the breast, which will give temporary relief for the mother. The next, complications. If it is untreated, it can lead to abscess formation or chronic mastitis, extreme inflammation of the breast tissues, or there might be pus formation in the breast tissues. So this can be the complication. How do you prevent this condition? You need to do a proper breastfeeding technique when you're breastfeeding the baby. Regular emptying of the breast is very much necessary in order to prevent this mastitis, and good hygiene practices. When and where prior to breastfeeding, you need to wipe your breast and the nipples, and infection should be avoided. So this is how you prevent the mastitis. So this was also a very important question for a 5 or a 10 marker. Next, let's move on to what is menopause. What is menopause? It is the natural cessation or stoppage of the menstruation marked by the end of a woman's reproductive years. So the women last years or last stage of the or cessation or the stoppage of the women's reproductive years is called as menopause. It's a natural process. So typically it occurs around the age of 45 to 55. It might be between the age of 45 to 55. It is diagnosed after the 12 consecutive months. How do you identify it? After 12 months, that is consecutive, continuous months of the stoppage of the menstruation or the menstrual period, then it is considered that menopause has occurred in that woman. So let's see what is the age range. Typically, it occurs between 45 to 55 years, and if you have to take an average of the age, it is usually the 51 years. 51st year is taken as the average year. It can occur between 45 to 55 years. Next, let's see what are the causes. Natural aging. So, as I just told you, the reproductive age ends and natural aging starts up. Surgical removal of the ovaries can also be one of the cause for menopause. Natural aging is a natural process, but here surgical removal of the ovaries, that can stop or cause menopause in the women. Chemotherapies, that can also cause menopause. The next may be the premature ovaries. So ovaries, if they are prematured insufficiently, then that also can be one of the main cause for the menopause. So there might be removal of the ovaries, chemotherapy, premature ovarian insufficiency, which can be one of the cause for menopause. Next is symptoms. Hot flashes, they can experience night sweats, mood swings, vaginal dryness, sleep disturbances, reduced bone density in the women. All this can be one of the symptoms that we can see in the women who have experienced or experiencing menopause. And the next we can see the hormonal changes. There is usually a decline in the estrogen and the progesterone levels, which is leading to various physiological effects. So you can see there are different bodily changes and symptoms due to this decline in the estrogen and progesterone levels. And that time there might be menopause. Next, we can see the health risks. There is increased risk of osteoporosis. The bones can become fragile, and there is cardiovascular diseases, urinary incontinence. There's no control over the urine excretion in the women. These are the health risks after the menopause. You can see the management. How do we manage this condition? Hormonal replacement therapy is one of the important management. You can replace the hormones. Lifestyle changes, you can adjust your lifestyle wherein which can also alter your hormonal levels. Symptom specific treatment. What are the different symptoms seen in that woman? Based on that, we can treat that woman. And like lubricants or antidepressants can also be given if it is necessary. This is how you manage the condition. Finally, how do we prevent and support this condition? Regular exercises is necessary, balanced diet, calcium and vitamin D intake. If in case their calcium levels and vitamin levels are very low, so you can give them supplements of calcium and vitamin D. And the mental health care is very much important in order to make sure your bodily health and hormonal are working, hormones are balanced inside the body. So this is how you're treating the menopause and prevention as well as supporting the menopause. So this was the end of this session. For more interesting and also important questions, please subscribe the Easy Nurse app. Thank you.